The UK's medical regulator has approved the Pfizer vaccine for children aged 12 to 15.
It said the vaccines worked just as well in young as in young adults.
But that doesn't mean you'll be offered it just yet.
The UK at the moment illustrates a tension with vaccination. Superficially, their numbers look good, with over 60% of adults fully vaccinated. But it's more like 50% of the whole population if you include adolescents and children. And that presents a challenge when a new variant like Delta is surging.
Basically, ever since, it's kind of been doubling every 7 to 9 days. We're now at about 30,000 cases a day, to go even higher until we really have vaccinated a lot more people.
Professor Christina Pagel is a public health modeller who sits on an independent committee offering advice to the UK government.
Hospitalisations and deaths are both increasing. Hospitalisations actually starting to increase quite rapidly now, 50% over the last week. But having said that, their absolute numbers are much, much lower than they would be without vaccination.
But what is stark about the overseas Delta outbreaks is that they're disproportionately affecting young people, most likely because they're the least vaccinated.
The people who are most protected, who have 2 doses, are basically the over 40s right now. So that means that in terms of infection, it's primarily young people and children. It's still true that children and young people are much less likely to get ill. But I mean, obviously, we are now seeing in hospital admissions that whole age demographic has shifted younger because they're less protected.
English Department of Education data show that 640,000 kids stayed home last week, mostly because they were in contact with potentially positive cases at school. And while kids overwhelmingly have mild COVID compared to adults, it's not entirely benign.
National surveys have shown that about 7 to 8% of children can get long COVID for more than 3 months, with, primary symptoms being things like fatigue and problems concentration.
The UK medicines regulator recently approved the use of Pfizer for adolescents aged 12 to 15. But the British government hasn't yet recommended vaccination for that group, while other countries such as the United States, Canada, France and Germany are pushing ahead. Vaccination rates are also important in adolescents and children to achieve herd immunity.
Without vaccinating children, they're 20% of our population. You can't do it. And the other way is just to allow children to get infected. I mean, to be honest, and that seems to be the government's plan, because they're removing all mitigations in schools. They've removed masks. They're removing the need to isolate. I can't support that, put it that way.
There's been much debate about the side effects of the AstraZeneca vaccine here. But in recent weeks, there have been reports overseas about less severe complications in young people who've had the mRNA vaccines.
The CDC is going to be holding an emergency meeting next week to talk about higher than expected cases of heart inflammation in 16 to 24-year-olds following doses of Pfizer and Moderna vaccines.
This is a problem that's mostly been described in countries with high mRNA vaccination rates, such as the US and Israel.
We're seeing a small number of young people develop inflammation of the heart muscle or the lining of the heart. So this is pericarditis or myocarditis. And we're seeing it in a small number of young, particularly young men, occurring between about 2 and 5 days after their second dose of the Pfizer vaccine.
Associate Professor Nick Cox is a cardiologist who's advising ATAGI, our advisory group on immunisation, on this rare complication of the Pfizer vaccine.
So they're presenting with chest pain and feeling unwell. Most of the people who have had this have needed to be admitted to hospital, and they've had short stays in hospital where they've undergone treatment with anti-inflammatory drugs, and all of them so far have rapidly recovered.
Early estimates of this mostly mild side effect vary from country to country, but the rate is probably around 1 in 50,000 second doses of the mRNA vaccines. Nick Cox says that's a much lesser problem than the heart complications from catching COVID itself.
With COVID, we're seeing people are getting inflammation of the heart muscle, and it seems to be much more sinister when it's due to COVID itself than when it's due to the reaction to the vaccine.
Let's put this into perspective. In New South Wales, as of this morning, 1 in 37 people with COVID were sick enough for intensive care, some of them young, and about 1 in 3 may end up with persistent symptoms. Compared to that, a 1 in 50,000 risk of a short episode of heart inflammation seems vanishingly small. Pfizer vaccination down to 12 years old is currently under consideration here by the Therapeutic Goods Administration.
Every country in the world is going to have to end up getting to herd immunity. And you either do it by vaccination or you do it by infection. And I think it's much, much safer for a child to be vaccinated than it is to get COVID.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.